and then I would get worse, and then I would sort of come back and get better and get worse. And, I worked my way through it with therapy. Therapy really helped, and medication as well. So
when you were weaning off of your meds, were you doing that in coordination with your doctor?
Well, I don't want to name names. Who was not a meds provider, who sort of quietly gave me advice that was not sound advice.
Okay. Yeah, I think I would tell anybody, if you're going to wean off meds for any mental illness, you'd certainly want to be in collaboration with your doctor and get guidelines on that.
And I wasn't. I was following the advice of a mental health professional, but not a meds provider.
Okay,
not a psychiatric nurse or a psychiatrist.
Okay, and then
so that was not the right thing to do.
Yeah, and then you also mentioned some of your reactions to some pieces of the stigma. I'm wondering if you could describe what that stigma was that came in your direction. And I'm also curious if you really believe, had you responded differently to what happened, would you have avoided a whole psychosis, or maybe would it have just been a more manageable psychosis?
Boy, that's a hard thing to say. That's a hard one. That's a hard question to answer.
Yeah.
It really is. Kind of the stigma that I felt was I frequently felt like people wouldn't take me seriously, that people would sort of dismiss me as, Sam's the crazy one. And I had experiences, I had struggled with people talking when people would mention my medications, I'd say, damn it, excuse my language, I'm sorry.
Oh, no problem at all.
I'd say, whose business is it to talk about my medications? Would it be appropriate for me to talk about your diabetes, about your insulin? This is my business, not yours,
Right.
And I felt that people were kind of talking behind my back about these things, or laying blame when I had struggles. And, I internalized it and I resented it. And, whether how I reacted would have led to a less severe psychosis, it's hard for me to say. But what I can say is that psychologically speaking, for anyone, mental health is a topic for all people because it's like physical health. We all have it.
Yeah.
Not everyone is mentally ill, but everyone has mental health. But resentment and anger are as I say, it's a killer of the spirit, and it leads nowhere good.
Yeah, I would completely agree.
And so I think my reaction to those things did lead to just not a very good frame of mind. And that's not going to help the situation when you're going down on your meds.
Right. So this question might also be really difficult to answer, but you had mentioned that in a way it sounded like you stated that you thought people were talking about you behind your back as well. And given the fact that you were diagnosed with paranoid schizophrenia, do you think some of it was made up in your head, and just you beating yourself up when it wasn't really happening, telling yourself your own negative narrative that you were making up essentially? Or do you think that it really was happening? And again, I know that's a challenging question.
It is a challenging question, and I think it's a little bit chicken and egg kind of a scenario. And I think what I say with psychosis is that all psychosis starts with a grain of truth. Was someone looking at you? Well, yeah, they were looking at you, but can you infer what they were thinking? No, you can't.
Right.
So it all starts with some semblance of reality sort of becoming distorted. And it's like a distorted picture, where you're not really seeing the true image, but, the same fragments of light are there, right? So I think there is some of both, and the most honest answer that I can say is I do think people, I think there was stigma that was happening, that was involved, but my reaction to that was disproportionate to what would be a healthy approach, right? if that kind of makes sense.
Yeah, absolutely. You mentioned the second psychosis involved a lot of ups and downs. Were there delusions at all, or hallucinations, or what were some of the significant
Yeah.
types of symptoms you had?
Yeah, my primary struggle as someone with schizophrenia has been around thought disorder and paranoia, but I have had hallucinations. When I was first sick, I did have some visual hallucinations, but they were like I remember waking up and seeing two men in the room. Like I thought there were two people in the room, and it would take about 2 minutes, and then those, like, they looked like shadows, but they looked like people. They would disappear. And I would see cats inside of my room running around that weren't there. So I did have some visual hallucinations. Then I had auditory hallucinations where I was hearing voices, and that was way more common than the visual hallucinations.
And were those voices that literally you were hearing in your head telling you something, or were those voices like you thought somebody was in the kitchen next to you?
Felt like they were in the kitchen next to me, kind of a voice.
Right.
Like a hallucination.
Yeah.
You know, the business of being told that I was the Antichrist was one of those hallucinations. And then I would hear sometimes like a choir of angels singing when there was none, right? So it was the combination, and the voices were always very condemning. You know, it was always centered on how I was bad in some way. Mm-hmm. And so throughout each psychosis, I had those events occurring.
And at the time, you're believing that they're really saying it, and these are real voices, right? And do you try to tell them to stop, or how do you react to something like that? I can't. Well, even imagine.
when it's first happening, you don't know what the hell is happening. You know, I mean, you have no clue. But I actually kind of learned over time to talk back to the voices and to challenge them.
Okay.
Interestingly, and
found that helpful.
Yeah, because I finally got to the point where it was like I understood that I was having a hallucination, and I mean I can distinctly remember walking up the hill, like being in recovery 4 or 5 years ago, and being like, well, I'm having a hallucination, but I can deal with this, and I can go get my kids, and I'm okay with it because I know it's a hallucination, you know. And but I haven't had them for a while. I haven't had a hallucination. The last time I had a hallucination, I had a major life-changing event, which led to depression this year. And it's what I would call situational or circumstantial depression.